Hello, I'm Mario Toneguzzi, managing editor of Canada's podcast, Taking Care of Business with Paula Allen, who is TELUS Health's global leader, research and well-being. Thanks for joining us today, Paula.
My pleasure.
Well, the latest mental health index has come out. Tell me overall what the key finding was of the index and the state of mental health in Canada right now.
Well, a number of findings this month, so not much change in terms of our overall mental health, but a few very important insights. One thing that we're finding is a third of us, a third of working Canadians are avoiding interaction with others, consciously avoiding that interaction. And two-thirds of those are avoiding that interaction in more significant way or have started that avoidance since the pandemic. So that's a big deal because we know that social support and feeling a part of a community and feeling a part of a group that you get with your interaction, that helps our mental health, and the lack of that actually can harm it. A few other things that we found around the impact of inflation and concern around children. So it was a fairly rich report.
So tell me, before we get into some of that other stuff, what are the reasons? Like, are people still scared that they're going to catch COVID, or like why have we lost that interaction with people?
Well, there's a few who are concerned about COVID, but that is definitely not the biggest driver. We've been trending to be more isolated as a society well before the pandemic. And then we had our behavior changed. So we weren't able to interact in an in-person way. We got used to and we adapted to having everything by ourselves, our work, our personal lives, our entertainment, our food, everything,
Yeah.
and have a habit. So unfortunately, habits can be good and habits can be not so good. And just the fact that we are not used to that contact anymore, it makes it feel more comfortable not to have it. And that's unfortunate.
And what are the consequences of not having contact with others?
Well, the main thing is that we want to avoid a sense of isolation. And when we have that sense of isolation, when we actually don't feel connection, deep relationships, when we don't feel social support, every stressor that we have, and every life has stressors, it feels worse. It feels more vulnerable. We know that the sense of social support helps us deal with life, just generally speaking. And if you take it to the extreme where people are isolated by circumstance, by behavior, by whatever means, then it definitely impacts your mental health. You're more likely to feel anxious. You're more likely to feel depressed. You're also more likely to have compromises in your physical health, cardiovascular and immune system health. There is so much of a strain on your body. We're just not built to live our lives alone.
Okay, now here's a result from the survey that I kind of found a little disturbing and concerning, is that 1 in 5 people are cutting back on health-related expenses, such as prescription medication. Is it simply a matter of costs for people?
Well, it was related to inflation and was related to the actions that people are taking as a result of inflation, because many people are not living with much of a cushion and have to make decisions on where they spend their money. I think it's a horrible and will have long-term consequence not investing in our health. So it's not an expense, it's an investment. And I do think that there is an opportunity for employers to really communicate what is available. Because many people, we know this at TELUS Health, many people are not aware of the benefits that are available to them, are not aware of the programs such as mental health programs and EAP, are not aware of all the supports that are available to them through their employer. And the first thing one should do is to make sure that you understand that and hopefully never come to a decision where you have to make a choice that leads you to cut back on health expenses.
Okay, let's look into a couple of other things from the report. First of all, the impact on children. How are children faring these days in terms of mental health?
Well, children are people too. And just like, we'd spoken a fair bit around the impact of the change and uncertainty and all the things that we experienced over the last little while, and even currently, the uncertainty and stress of the current situation, that impacts children also. We found that, about 3 out of 10, almost 3 out of 10 parents are concerned about how, things are expressing themselves in the behavior of their children. Because typically, when you know something is wrong, is when there is a change in behavior. So paying
Yeah.
attention to that really makes a lot of sense. And about half of parents said that this concern is new since the pandemic. So the strain that we're all under has actually impacted our children without question and on an ongoing basis.
Okay, and final thing I want to talk to you about is remote work, and obviously, remote work was a trend prior to the pandemic, but as the pandemic moved along, it became much more so a trend in society and the workplace. What does the report tell us about remote work and its impact on mental health of Canadians?
Well, there's some positives, and just like life itself, some things that are good and positive also have negative unintended consequences. So there is some concern around not feeling connected. There is some concern about not being recognized. And there is some valid concern, even if it's not to the forefront of people's awareness of it contributing to the isolation. And what I would say about that is that we're not going to stop this trend. We are going to have to figure out how to deal with it. At some point, we might come together in congregate settings a little bit more than we are right now. That'll evolve over time. But even for the time that we are working apart, it doesn't necessarily mean that we can't invest in relationships, that we can't just, spend some time with people, get to know them, make sure that we're showing recognition and make sure that we're showing gratitude. Develop some shared experiences, have time that is not virtual.
Mhm.
It's so important that we adapt to this, and it's a skill that we need to develop in person as well as not in person. And I think we're sort of losing that skill because all of this change happened on us so quickly.
Okay, wonderful. Well, thanks very much, Paula, for joining us today.
My pleasure.
All right, that was Paula Allen, TELUS Health's global leader, research and well-being. I'm Mario Toneguzzi, managing editor of Canada's podcast, Taking Care of Business today. Thanks for joining us.